Thank you so much for joining us this morning, maybe this afternoon if you're out on the East Coast like Lexi, to talk about providing peace of mind, not only in your life, but in your family's life, and how MASA's done that for over 50 years. But MASA's been the global industry leader for over 50 years now. They started out in 1974, but today they have over 2 million members worldwide, 18 international offices, and 48 states that they have corporate partnerships with, different universities, state governments, firefighter associations, hospital associations, and independent school districts that have contracts with MASA to provide to their employees. Well, why is that? Well, because there is a leading kind of situation going on in the industry, excuse me, that happens that when it comes to air and ground ambulance transportation or emergency transportation in the U.S. But one of the biggest questions we get is, will Medicare and or my primary health insurance cover ambulance rides? When I dial 911, is that service paid for? And the answer is Medicare and your primary insurance do not always cover emergency air and ground ambulance costs. This leaves you vulnerable to the expenses and unpredicted medical bills. I've seen different bills, and we're going to cover different bills here later on in the presentation of what people have received from $2,000 up to $30,000 and beyond. And really, you're going to learn today how there's not a lot of regulation when it comes to this. And with that, that leaves you, the patient, the recipient, more out of pocket than what you thought you were when you were needing those emergency services. But 1 in 4 families require an ambulance every 3 years in the United States. 35% increase in ride costs over the past 5 years. That's like what they've been charging, not what they're paying, but what the ambulance company has been charging for their services, whether it's ground, air, sea, whatever it might be, for your emergency services and what they cost. And then as far as hospital closures from 2018 to 2021, there's been 105 of those across the U.S. And we're going to talk about why that's so important, because getting you to a certain level of hospital to get the care you need in the time you need it during that golden hour that you probably heard about before. Changes in Medicare, especially here recently for 2026, are directly affecting costs when it comes to emergency transportation costs. First being when they passed the Affordable Health Care Act, and there was a $716 billion cut to Medicare, which some of those services fell on ambulance costs, transportation costs, costs that Medicare could incur before you get to the hospital. So that had a big area of cut. So that's part of why we've seen such a part of that 35% increase, you can say, to the cost of ambulance transportation costs. And then more out of pocket, higher premiums, higher Medicare premiums, higher deductibles, cost sharing paid by your beneficiaries. More clients nowadays having to rely on other families to help pay for these large expenditures and these unsurprised bills because of the lack of Medicare paying. And you might have caught that very last news article before we got started, that was before the No Surprises Act got passed. But I'm going to play you a short news article that has been since that has gotten passed, and what has really been shed to light, especially when it comes to ground transportation costs in the United States. But why are we talking about this? Well, Medicare is facing financial pressure from aging population, growing enrollment, higher healthcare costs. In an independent study out there, they did some studies to figure out what the projected cost of Medicare would be in the future. It's going from 829 billion in 2021, and they're projecting it to go up to 1.8 trillion with a T. And with those costs being that high, you can imagine that in that same price structure, in that same step or escalator or staircase that you see there, that ambulance costs is in that same price scale amongst what's changing with Medicare. But there's three ways that you can incur unexpected ambulance cost, or whether it's ground ambulance or air ambulance. The first one being failure to prove medical necessity. Okay. Medicare specifically in their new Medicare New 2026 handbook, it says in there, they have a usual and customary charges handbook, something that they look through that figures out, could a neighbor have taken you? Could, your spouse taken you? As an example, me and my wife, or Lexi and her husband, if they something happened to them and they called 911, Medicare, and we're all on Medicare, Medicare is going to try to figure out, well, could your spouse have taken you? Could somebody else have done it? Was it truly an emergency? And they're going to try to wiggle their way out of that gray area of not having to pay for it. But in addition to that, it falls on this handbook that they have, this usual and customary charges. And the best way I can describe that, Lexi, is think about this. You have a vehicle and your vehicle breaks down. And when your vehicle breaks down, you take it to a mechanic. And they look at it and they say, Lexi, this is what's wrong with your vehicle. And you say, that's okay. I got a warranty. And you call your warranty company, and your warranty company says, oh, we're going to want someone to come out and look at it. So they do, and they say, yeah, it's broken. Yeah, it's in our guidelines that we'll pay for it. But our little handbook says that job should only cost $1,000, where your mechanic is maybe charging you $2,000. Okay? And then at that point, Lexi, it's your choice. You can either pay the difference of what your mechanic that's looking at that job is charging you and what your warranty will cover, and you're out of pocket $1,000, or you could take that vehicle to somebody else, some other mechanic that can do it for a cheaper job, okay, and do it for that $1,000. That works the exact same way when it comes to ground ambulance transportations, except you've already gotten the service done. Their little handbook says that job should only cost $500, and maybe the ambulance company charged you $1,500. And if they're out of network, then that's how they're charging you the difference. And that's what leads us into that second bullet point of three ways to incur those unexpected charges. And statistics out there are 79% of all ground ambulance rides could result in an out-of-network bill. And you're going to learn here in this quick little video I'm here about to show you on the same news article, CBS News article, where they talk about that and how they talk about AMR, who you just heard about, the largest ground ambulance in the company, charging people, being out of network. And most ground ambulances are out of network. Well, why is that? So they can charge the full $1,500 and get the difference. Because if they're in network, they got to accept the $500 or whatever the insurance company's handbook said that they would pay out. And then in addition to that, another way to incur unexpected charges are copays, deductibles, ways your insurance works. You still have, like as an example, in your state benefit, we're right here in Texas, and with the retired educators benefit, they have a ground ambulance copay that they have to pay with their Advantage plan. They have some things that they have to meet. That's if it's covered. So will they incur charge? Absolutely. They absolutely will. And that's just covering the first trip. And we'll talk about what I mean by that. But watch this short little video and then we'll get started, or we'll finish up here in just a second.
This morning, in our continuing Bill of the Month partnership with Kaiser Health News and NPR, we are talking about surprise ambulance bills. Last September, an Illinois woman was driving with her brother and her sister when their car collided with a pickup truck. Well, the second shock was when they all received very different bills for identical rides to the hospital in an ambulance.
You think you might have some control over the car, but you don't.
After a car crash, Peggy Dula and her two siblings were transported to the same hospital in 3 separate ambulances. Peggy's injury, a bruised sternum, was the least severe.
And my ambulance bill was $36.06, which I thought was really high.
It was nearly triple her sister's bill.
I couldn't even get anyone to offer an explanation as to the different pricing.
Each ambulance was from a different taxpayer-funded Illinois Fire Protection District and charged a different rate for medical services and mileage driven. Peggy was charged more than double the rate of her siblings' ambulances for medical services and $30 per mile for transportation, while the other two charged $10 per mile.
So I called the paramedic billing service. They basically told me there was little they could do, that the rate was set by the fire district.
Peggy says she's repeatedly tried to contact the Pingree Grove and Countryside Fire District, but the fire chief has not returned her calls.
I felt really powerless, actually, to do anything, to change anything.
Peggy's medical insurance covered 60% of what they deemed to be the reasonable and customary rate for the services she'd received, according to her plan. She was left, that means, with a remaining balance of over $2,700.
I don't have a tremendous amount of money. That's a sizable amount for me.
We are happy to say that all three siblings have recovered from their physical injuries. Their financial injuries, though, that's another matter. Peggy Dula says she reached out to paramedic billing services multiple times and tried to negotiate her bill. She also made a $40 payment in good faith. However, the bill was sent to collections. Paramedic billing services vice president, that's Michael Tillman, says patients must dispute charges directly with the ambulance service. All right. The Pingree Grove and Countryside fire chief did not respond to our request for comment, but told Kaiser Health News the charges are in keeping with the federal Ground Emergency Medical Transportation Program, which you've probably never heard of until now. Dr. Elizabeth Rosenthal is editor-in-chief of Kaiser Health News, and she joins us now. Okay, wow.
Yeah, mind-blowing, huh?
It's all mind-blowing because you don't know these costs ahead of time. You get the bill after the fact. So how is it that a company, an ambulance service, can provide the same service as another but charge a completely different price?
Well, because ambulance services can charge whatever they want, and they can join whichever insurance networks they want. And you know what? These days, many, if not most, ambulance services decide to join none.
So what are people supposed to do? I mean, hop on one foot on the corner and wait for like the cheap
Call an Uber
ambulance to come by? You know, what's the...
Right, Google, are you in my network? You're kind of a sitting duck, and that's really the problem that Peggy faced. I mean, she was the least injured, and she got the biggest bill. And, you know, in retrospect, she should have let her daughter take her to a doctor or called an Uber.
Jeez. So when you call 911, you're not able to ask for the price of the ambulance. That's not part of the conversation.
You're not even able to ask for which ambulance. I mean, basically, 911 goes out, and ambulances, as in this case, just arrive, and you don't know where they're from, whether they're in your network, what they're going to charge you.
When you're actually in the ambulance on the stretcher there, can you raise your hand if capable and say, please take me to an in-network hospital?
You can ask, but they are unlikely to do so. They take you where they want.
I've always heard when an ambulance shows up, you have to get in. Is there any truth to that?
No. I mean, I always tell people you can say no. Now, the ambulance worker is always probably going to say, better to get checked out, but you might think better to get checked out, but I feel okay. Of course, if you have a head injury or you feel really bad, you should just get in and not worry about the cost. But you know, it's really so unfair to patients, and this is the one thing that was left out of that No Surprises Act.
Yeah.
I mean, you know, out-of-network anesthesiologists, out-of-network air ambulances are in, but ground ambulances, why?
So it was left out of the No Surprises Act. Is that an oversight, or did someone ask for that?
Well, there's some speculation that ground ambulance companies are revenue generators, right, for many local fire departments. So
That makes sense, literally.
Yeah.
it makes sense literally, but it's not great for patients.
Of course not.
Is there any way that a combination of auto insurance with medical insurance can help deviate some of these costs?
Well, you know, 12 states require people to have personal injury protection insurance with their car insurance. In that case, the car insurance health protections kick in first. But for Peggy, that might have helped. But also, we've run a bill of the month where auto insurance, personal insurance protection is very limited, 250,000. If you have a big accident, you can be really out of luck that way. So, you know, you're really out of luck one way or the other.
Great.
Sorry.
Fantastic
Sorry
news.
for the bad news this morning. But
it's realistic.
It's really a hole in our legislation, and it's really should be plugged, I think.
Oh, boy.
Thanks for bringing attention to it.
I hope it is. Thank you very much.
And that's a news article that, you know, after the No Surprises Act passed, you know, what people were starting to face, you know, and it's been a few years since then. We've seen rising costs since then. We've seen rates go up. But it got to a point where even before then, and since then, Medicare updates this little handbook that you're seeing there on the screen here. But Medicare actually created their own little pamphlet that says Medicare coverage for or of ambulance services. And even on the front cover, it even says what to do if Medicare doesn't cover your ambulance service. You know, what programs you can be a part of and things you can be a part of to eventually pay for it and get it off your record and you know, get this debt, you know, off your head. One of those being collecting money from family members. You know, again, don't be a burden to others. Don't be a burden to yourself or your finances. A lot of people have saved up their nest egg to leave to family members or have in the event later on for long-term emergencies, but you would hate to see your almost entire nest egg dwindled away by one bill, by one helicopter ride. And you know, the good news is with the MASA guarantee, it doesn't matter which company picks you up. It doesn't matter what service you get. No matter wherever it is in the world, you're covered 100%. And that's where MASA comes in as being a payer, not a provider. And that's the biggest thing to keep and stand with in your mind, and why your association has endorsed the program, because it doesn't matter who you call when you call 911 or who shows up when you call 911. MASA is going to cover them 100%. But why MASA matters today and tomorrow? Well, like I've been talking about, like you've seen in those videos, which still stands true today in the statistics that we're getting, the average ground ambulance bill is around $2,000. And costly bills have become the normal because of insurance, because of them being out of network, also because of hospital closures, which we'll talk about that, okay? But a majority of the emergencies occurring between the ages of 51 and 90 years old. Does that mean somebody younger could face an emergency? Absolutely. I live right outside of a brand new high school, and I pull out of my neighborhood the same way every day to go to the store, to go to church, to go get gas. It's kind of a one-way in, one-way out style neighborhood. And all it takes is a high schooler and their dad's new dually truck to run a stop sign, to not be paying attention, to be showing off, to be doing something, texting, anything. And maybe I'm doing my normal thing that I typically have always done, and then an accident happens. But a really horrifying statistic out there that I've read and that we made sure to put out here is that 60% of Americans have to borrow just to cover $1,000 in health expenses. They have to borrow money at the interest rates today and inflation today and what's going on with money today. It is not the time to borrow money unless it's an absolute necessity. And I hate to see a retiree get in that sort of situation because of it. And so what are bills that people are facing? Well, here's a ground ambulance bill for someone that was on Medicare. Now, this was paid by MASA. But you can see on there that there's two types of services, BLS, and there's another one that you could see that would be ALS, okay? Now, in this sort of situation, even with their major medical insurance or their supplementary insurance to their Medicare, they denied it. Both of them denied the claim, found some sort of reason. That's that. Could your relative have taken you? Could your neighbor have taken you? Was it a true emergency? But this person felt like it was. That's why they called 911. And unfortunately, because of that, they had a almost $5,000 bill waiting for them. But because they had MASA, it was paid 100%, gave them that continual peace of mind. Now, I always hear, well, what about TRICARE? What about Champ VA? What about Blue Cross Blue Shield Federal? Surely those insurances cover it. Well, I got to say, AMBA is endorsed by the Military Officers Association of America, who deal with everybody that is in their association, has TRICARE. They're all military officers and family members of military officers. And TRICARE falls in the same line with what Medicare does, with what any other major medical does, which is what I talked about. They use that handbook, okay? This was a ground ambulance trip to the VA hospital specifically, ended up being $2,100. This person had MASA, paid it 100%, gave them the peace of mind that they deserved and you deserve. Then that last one, an air ambulance ride. Wowee. Just to turn on the helicopter, they charged them $15,000. Then they charge you the mileage to come pick you up, and then the mileage from there to the hospital, and then you actually get charged also the mileage from it back to the base. Okay? All these mileage charges totaling 150 miles, an additional $23,000, $40,000 air ambulance bill. Primary insurance, Medicare. This little note at the bottom of the bill, we filed a claim with your insurance company and they've denied the payment. This bill is your responsibility. This person was a MASA member, paid, gave them the peace of mind that they deserve and you deserve. But again, why are we talking about it? 105 hospitals just closed over this past year in the over the past few years in the United States. More are continuing to close. You might have heard of hospitals in your area closing. But it's super important because there's several different trauma levels when it comes to hospitals. Okay. Level 4 being the lowest, all the way up to level 2 and level 1 being where they can actually initiate the correction or what needs to be done to provide your care. As an example, right outside my neighborhood is an Integra Care Urgent Care. That is a level 4 hospital or a level 4 trauma center, which, as you can read the definition there, it provides evaluation, which they do, stabilization. They'll stop me from bleeding out if I'm bleeding out prior to transfer to a higher level of trauma center. The closest level 1 trauma center to me is Fort Worth, almost 40 miles from me. So if I went there and then I got transported by ambulance from there to the hospital, my insurance would tell me, well, we would have covered you if you called 911 and it took you to this minor emergency. But because this is the secondary transport in your care, it's not covered. Then in addition to that, we're not even talking air ambulance transportations. Majority of the transportations we're seeing people receive bills for are these hospital to hospital transport in large scenarios like this. Maybe the closest hospital to you is only a level 3 or only a level 2 and you needed a level 1. And they have to air flight you or evac you to a level 1 hospital. Over 550,000 air ambulance transportations a year. That's one every minute. So what does that mean? That means in the 27 minutes that you have been on this call talking to me, there's been 27 air transportation in the U.S. somewhere. And somebody is unfortunately getting a bill for that. Maybe all of them. And I don't want that to be anybody that's in the sound of my voice because it's a growing issue in the United States. This is where the majority of emergency fall, like I talked about, anywhere between 51 and 90 years of age. But can it happen to anybody else? Absolutely it can. Even I have MASA and have my 20-month-old son that would be in the 0 to 10 range of needing to call 911. Now, my child, unfortunately, boys being boys, jumped off of a bottom step of a staircase that was only 2 steps, but he jumped off 1 step and he ended up breaking his leg. Okay, I found out children have spongy bones, and that's what happens sometimes. Praise the Lord, it wasn't something serious I had to call 911, but if I did, he's covered under MASA. If it was an emergency, he's covered under MASA. I'm having a newborn, a baby girl any day. If something happens after she's born, guess what? She's covered under MASA. And because I'm already on the family plan, it's no difference in price by adding another dependent on the program. But nearly one EMS call for every 10 people are given annually in the United States. One for every 10 people, anywhere from 0 to 120 years old. Wow. That's a lot. That's way more than the air ambulance rides that have already happened. And by the way, we're already at 29. We've gained 2 since we've been talking, just to keep in mind of how frequently it happens. Here's the solution of what MASA's out there and why their name is out there and why they've been around for so long and why they're with so many countries and over 2 million members. They offer 100% total peace of mind because they cover 100% of ground and air transportation. They cover that hospital to hospital transports that we just talked about. In addition to that, they have return transportation back home, bringing you back home to your doctors, your nurses, your family, where you can recuperate back at home, especially for those that travel. But what other benefits come with it was a totaling of 19 different benefits, the core benefits being those air and ground ambulance 911 transportation costs. But it's got anywhere from any of these benefits for loved ones and other cared ones and people that for minor return and visitor return and pet return if they're with us, even extra care benefits like payment advisors. Man, I can't tell you how many horror stories I've heard of people that were unfortunately had a horrific situation or emergency go on, and then when they got home, they had a shoebox full of letters already back from all the different doctor's visits and the bills they had to pay and things like that. MASA actually has a service, a white glove service that will sit down with you and consolidate those bills, negotiate payment plans, really take the pressure and worry off you. You know, how horrific is it to go in the hospital for some sort of heart related issue and come out and your heart already is going crazy because of all the bills and things that are piling up while you were gone. But some highlights I really want to hit on that are big amongst current MASA members, especially the Shield members. It's the grandchildren and great grandchildren protection. And that typically used to be if you had a platinum program, if they were in your care and something happened, they would get some sort of coverage. What this is, they don't even have to live with you. If you live in the great state of Texas or the great state of Florida or any other great states in the great US, all 50 states, and you have grandbabies that live in another one of those great states, and something happens to them and their parents call 911, your MASA will pay for their ground ambulance bill. Now they got to be minors, okay? They got to be under 18, but that's grandchildren and great grandchildren. Here's what I love. No limit to how many can be on it. I actually was just meeting with a gentleman that works for AMBA yesterday, and he's one of 8 kids. He lives in Utah, and he said with all his siblings that have children, there's 32 grandchildren already in the family. No great grandbabies, but grandchildren. 32 of them. So that means if his parents had the emergency shield program, which they might, I'm not for sure if they do or not, but if they did, they would cover their ground ambulance rides if something happened to them, even if they were in another state. In addition to that, they have this companion transportation. And before on the MASA Platinum program, this is why I love the Shield, is because before, if you were traveling by yourself and your spouse was at home and something happened to you while you were traveling and you went in the hospital, you would have had to have been at that hospital for at least 7 days before MASA would fly your spouse or someone out to come see you. Under the Shield program, that 7 days is eliminated. They will allow them to fly out to you immediately when something happens when you're taken to a hospital and you're not with somebody. In addition to that, they help pay for extended hospital stays and incidental expenses for that person that's visiting and staying there. Money for food. No, they're not going to let you go to Perry's Steakhouse or some fancy steakhouse and spend $900 on a meal, but they're going to give you some money for food and they're going to give you some money for a hotel stay. And it might not cover 100%, but golly gee whiz, it sure will help. But what the MASA guarantee is there's no health questions, no age limits, no claim forms, no deductibles, no network limitations, worldwide coverage, and even better, if they purchase or enroll in the program through their association, which means enrolling through you. Yeah, I'm looking you in the screen, all 37 of you that are on this call, okay, and watching. That there's no pre-existing conditions. It does not apply if they enroll through you. If they enroll through MASA to the general public, does pre-existing conditions apply? Yes. That is a key benefit of getting it through your association, other than the price difference, which we're going to talk about here shortly. But it's really 3 simple steps when you go to file a claim. Number 1, something happens to you. First and foremost, you call 911, knowing that you have MASA. And I got my wallet right here, and in the fold of my wallet have my MASA card. But if something happens, do I call them? No. I call 911 and I go get whatever service I need. And once I'm stable, if I need to be transported to another hospital, then I can flip over my MASA card and I can call this 1-800 number on the back and speak to a live representative, and they can arrange the transfer either back home or to the other hospital. But if it's just that emergency situation, all I do is wait for the bill to come in. And when that bill comes in, I send it to MASA. There is a way to upload your bill through your MASA portal, which is a new thing they've added for 2025. So I want to encourage you to use that. But as always, you can fax it in, you can mail it in, there, you can get them to them any way you need to, but please get it in within a timely manner. Okay, what does that mean? You need to get it in at least a minimum with inside 12 months of whenever the incident happens. And if for some reason you're approaching that time frame and for some reason you still haven't gotten a bill, then you need to call MASA and tell them, I still haven't gotten a bill from an ambulance. They will notate that on your account, and whenever the bill comes in, then they know that you're staying on top of it, and they'll still pay the bill even outside that 12-month period. But they have to have record that you called in and have notified them that a bill still hadn't come yet. But then after you submit the bill, it's simply that MASA pays the bill. There's no copay, no deductible, no certain amount of miles you got to be from home to use it, no certain amount of miles that they're going to cover, and that's it. It's simply sending the bill in 1, 2, and 3, and then your needs are taken care of, and you get that peace of mind. What does that peace of mind cost you? Well, they've really divided it up into 3 different options for you, okay? And you know, there is a ownership option, and then there's renting options. And even inside the renting options, they've still given you some ways to save some additional money. And the same reason you would own it is the same reason you own everything else. You don't have to make payments on it. It's a one-time fee. You don't have to worry about it. And mainly what it's, especially those of you that have families, it's you're giving yourself peace of mind. And then if something happened to you, knowing your spouse is taken care of for the entirety of their life if they ever had an emergency and you weren't there. And so what does that cost you? Well, to the general public, it's over $5,000 for a family, almost $5,000 for an individual membership. But you, as an association member, get a discount. It's only $4,900. You save $600 by being a member, plus the medical ID wristband, which we'll talk about here in just a minute, which is super important. The next benefit is that 5-year benefit. We call it the renting option, but it's a way also to prepay and save some additional monies. The general public, again, over $3,000 for a family plan, almost $2,500 for an individual plan. But as you as an association member, $2,700. You as an individual, $2,100 for a little over $300, or right at $300 in savings with that as well. And then the monthly plan, and that's the plan I'm on. I'm on the monthly plan. So it doesn't matter which level you get coverage at all. It's just some additional savings by owning it, by prepaying it. You get some additional savings there. And it's an absolute win. Almost a full year by prepaying if you do the 5 years. You for sure get, you're paying for 9 years when you do the lifetime, but you own it for the entirety of your life. Okay, but the general public is paying well over $60 a month, or over $60 a month for a family plan, and over $50 a month for an individual plan. But it's under $50 for a family plan, under $40 for an individual plan, for you to have the monthly program through your association at a discounted rate. But why, in addition to that, am I doing the lifetime benefit? Well, with me talking about bills being anywhere from $2,000 to $50,000, one claim pays for your ownership of MASA. And it doesn't just stop paying for it there, it continues to pay for it for the entirety of your life. You have it forever. And I've had people say, "Well, Jacob, what happens if I'm a individual person and I buy the lifetime plan and I pass away?" Well, as I always kind of chuckle, I say, "Well, you won't be here to know the money's gone. You won't be here to know that you're not using the plan anymore because you passed away." If you're on a family plan, what you're doing is covering yourself while you're here and covering your spouse while you're not here, giving that ultimate peace of mind. But as I talked about, you get that medical ID wristband with your lifetime benefit. You'll see right there, there's a little red star on there. They call that the Star of Life, okay? And it's a medical star. And all EMTs across the country are trained to look for that when they come up on somebody, because that means I'm special. Typically, that's when you have people that are like diabetics or allergic to certain medications or have seizures or things like that. They'll have wristbands they'll carry around on them, and jewelry and things like that. But what this wristband does is it has a QR code on the back. You upload all your meds on there, maybe what you're allergic to, what your special conditions are. As an example, my father can't have NSAIDs, okay? That's like Tylenol, and so allergic to it. If he's passed out, he can't tell an EMT that. Okay, so they need to know that sort of stuff. If people are diabetics, they need to know, is somebody taking fast acting or slow acting insulin? What's the brand? What's the dosage? And you might be a spouse and you might say, "You know what? I know my husband's dosage. I know my wife's dosage. If something were to happen, would you be able to spout that off? If it was an emergency situation and it was frantic and they were having a heart attack or having a diabetic stroke, would you be able to spout that off in a chaotic situation? Or would it be easier for that EMT to scan that QR code and pull up your meds instantly?" Instantly. In addition to that, I'd just like to leave on here. This is the kind of final slide, just a reminder of what all the prices are. But by you attending today, by you listening to this presentation, your association has done a wonderful thing and has allowed us to waive the typical $60 enrollment fee while we're doing this presentation. And so instead of the $49 plus the $60, meaning $109 to enroll typically, it's only going to cost $49, and that's it. And it gives you that peace of mind, because the moment you sign on that dotted line, the moment you hand over the application with the payment, you're covered instantaneously. That means you walk out this door, you get in your car, you go to the grocery store, you go to dinner, you go back up to your room, you go anywhere, you go to church the next day, something happens to you, you have the peace of mind of calling 911 like myself, like I do, and knowing that the bill's covered 100%.